I showed up on September 21st, 2001. I had the sort of the interesting experience to walk into a place I knew nothing about, knowing that I was supposed to have this leadership position to lead the healthcare for the entire U.S. military after we had just been attacked on 9/11. We had about 130,000 people. So that's how many people I ultimately had responsibility for in terms of the policies and the budget and the programs. And those were the people that were supporting our military men and women and working in the hospitals and clinics and deployed all over the world. In terms of the people we served, which included the active duty military, their families, and also retirees who earned a benefit for life, there were about 9.5 million people. It was very helpful, the experience that I'd had in the past as a physician, as a frontline medical director and medical leader, as somebody who had actually worked at a health insurance company in a leadership role. So all those things were helpful, but they weren't sufficient. This was a whole magnitude level bigger set of responsibilities, and some of it, you just have to jump in and learn. In every war that the United States has been in, we learn a lot about how to better care for people with injuries and wounds and illnesses. In the first Gulf War, some people may remember that back in the early 1990s, we had even a larger number of people who deployed. We had only paper records at that point. Many of those people came into contact with toxins, with smoke, with environmental issues, and they came back with problems that got labeled Gulf War syndrome. We knew we needed a record-keeping system that could actually record things where they happened and when they happened, and the record moved with the person. It's just kind of a common sense type of thing. And so we made that major commitment to install a record system like that that was global. You're constantly looking, the bottom line, every way you can to protect people, to prevent illness. It's the same in many ways as in the private sector. It's just in a more acute and more intense way that you do these things to ensure that the people that go out and fight and die for us, are as protected as they can be.